Hello students! Today's video lecture is on the cranial and facial bones of the skull. We're going to be using pages 7 and 8 of our notes packet and also be referencing page 6, which is the Skull Master List. The only bones that we're going to be covering in the Skull Master List today are the 8 cranial bones, the 14 facial bones, and I will also introduce you to this associated nearby bone called the hyoid bone. So let's get started. The cranial bones are the bones that encase the brain. And so obviously we know our brain is going to reside within the cranial cavity. And so it is going to be these flat bones of the skull that encase the brain. The number on your master list next to the bone name tells you how many of those bones that you have. So, for example, the frontal bone there's only one of. Sometimes you can hear that said as it is unpaired, like there's not a pair of them. Temporal, there's 2, so there's a pair of temporal bones, one on the right, one on the left. You get the idea there. So the 8 actually includes 2 temporal, 2 parietal, and then the rest singles. The frontal bone is this forehead bone here. And you can see it reaches pretty high onto the top of the skull and pretty far into the eye socket. So it actually forms the roof of the eye socket as well. So go ahead and color that on your page. That's letter C. Right now we're just doing the bones. And so what you may want to do is color C in every view that you can see it, because each one of these views is a little bit unique. And I'll go over the views on the second page in just a minute. So that's the frontal bone. The parietal bone, like your master list says, there are 2 of those. And these are the plainest, most boring bones of the body. There's no important parts to them virtually. They're just thin and flat. And you can see there's really not much going on with the parietal bone. The frontal bone, at least it has this little ridge on the inside. And there's some external features that we won't learn, but it has a little bit more going on. But the parietal bone is pretty plain. So on your diagram, that is letter B. The temporal bone actually has quite a bit going on, and I'm going to hide these ligaments, here. So we can see that the temporal bone actually makes a joint with the mandible. Here's the temporal bone. It's got our outer ear hole in it. We'll learn the name for that later. It's got this pretty unique lumpy bump that hangs down behind our ear. And if we get really close, we can see right underneath the ear hole is this very strange little spiky thing. We'll learn all these terms later, that has ligaments going from it to the mandible into this other bone below. So that is the temporal bone. It occurs on both sides. Again, here's the ligaments that form the joint between temporal and mandible. And if I delete one of my parietals, we can see the temporal has quite an interesting structure on the inside. It's got a little mountain range and a major opening in it. So that's the temporal bone. The occipital bone is all the way in the back. Keep in mind I've deleted one of my parietal bones, so the occipital bone all the way in the back. It contains the massive opening at the bottom of the skull that allows the spinal cord to exit. That's the occipital bone. And then one of the most interesting bones of the entire skeleton is this bone called the sphenoid bone. Now, from the outside, we see it here by the temple, not to be confused with temporal, sphenoid, and then also in the back of the eye socket. You will not be able to see it through the nose here in your diagrams. It's way too far in. So you'll see it in your anterior view diagram as in the eye socket, in the temple, and then it has this very unique butterfly shape inside your skull. So sphenoid bone is letter F. Let's make sure we're caught up. C was frontal, B parietal, D temporal, A occipital, and F, everywhere you see it, sphenoid. Now, the ethmoid bone is hard to get to. It is situated sort of between the eyes, but behind these nasal bones here. So here's part of the ethmoid bone. See that tucked away in there? And this part is also ethmoid, as well as all of this. I'm not sure why the atlas doesn't like to highlight all of it together. All this is ethmoid. It has a very strange structure. Look at all those lumps and bumps up your nose. Forms part of the nasal septum, part of the eye socket, the medial aspect of the eye socket, and then inside your cranial cavity towards the front. There's even this little, looks like a little shark fin there. All part of the ethmoid bone. So that concludes the cranial bones. The next thing we're going to look at are the facial bones here. And again, the number will tell you if they are paired or not. These are harder to tell. For example, maxilla looks like it's all one solid bone, but is actually originally two. The other ones I think are a little easier to tell. So let's talk about the facial bones. One of the most notable facial bones is the lower jaw, and that is called the mandible. We will learn all about its parts later on. So mandible is lower jaw. Sometimes you see it from the bottom, but not often. The upper jaw, and I'm calling it that because it's got the teeth in it, is the maxilla. So there's two of those, one mandible, and then you have maxilla on the right and left. So notice the shape of that is very irregular. It forms the large percentage of the floor of the eye orbit and the sort of area between your nose and your mouth, and then all the way up between the eyes, maxilla. The maxilla also forms, again, I don't know why it's not highlighted, but a large portion of the roof of the mouth. See where we are there? That's the roof of the mouth. I don't know if you can follow me on this. Here's the upper teeth and the lower teeth. So we're actually looking at the roof of the mouth. So that's the maxilla. You have two cheekbones. Those are called, the zygomatic bones. Let me get this going here. Zygomatic forms most of the lateral aspect of the eye socket. Zygomatic. Notice part of it sort of reaches back towards the temporal bone. These guys make a little bony bridge right here. We'll talk about it later. Zygomatic, two of those. Okay, and it's right in front of, there's the sphenoid. There's the zygomatic. But notice there's a depth difference there that sometimes does not convey on the images, flat images. So there's sphenoid, there's zygomatic, making that cheekbone area. There's two nasal bones at the bridge of the nose. This is where like your glasses would sit, on the section between your eyes. Two nasal bones. And then we get into the nose. Now, within the nose, it's a little tricky to show, but there's this slice down here called the vomer bone. And I'm wondering if I delete my maxilla. Bear with me, it's going to look pretty freaky. All right, so let's just look at it from this view. So there's half the face, and then as I turn, the bottom part of the nose divider called the nasal septum is the vomer bone. But look at the shape of that. Okay, it's not just what we see in our image, letter, looks like a H there in the center. What we see, let me zoom in here, is just this little piece, and that is by no means the full story. So H, if you follow that over to this side, here is the vomer bone. So that's the vomer bone. On either side of it are these strange bones that come in from the side of the nasal cavity inward like a curve. That's called the inferior one on one side, one on the other. Inferior nasal concha. And if you're going to say it plural, it's conchae. So it's named after a conch shell. You know, those shells that you listen to by the ocean, and they sound like they have the ocean inside of them because of that weird curvature there. Now, it's called the inferior because the ethmoid bone, which is like right up in here, has two more of those. So these are actually their own bone. Inferior nasal conchae are their own bones, one on the right and one on the left. And notice it's coming off of the lateral aspect of the nasal cavity and curving in. This helps to make sure that the air is turbulent when it goes through your nasal cavity, so it swirls around so it can get moisturized and filtered and warmed adequately. So vomer in the center, inferior nasal conchae at the sides. And then up here, so here was maxilla, here's ethmoid. Between them is this tiny little bone called the lacrimal bone. Now, if I zoom out, I'm going to creep you out for a second. Here's the eyeball. So you can see in reference to the eyeball, lacrimal means tears in Latin. This is where the drainage for the tears is. There is a little sort of indentation that houses part of the tear drainage apparatus. So lacrimal there and there. And then immediately behind it is ethmoid. Okay, so ethmoid, lacrimal, maxilla, nasal. And then the last bone, I think I got them all except, watch while I tip. Tipping, tipping, tipping. You can't see this from the front. Remember before that I said the majority of the roof of the mouth was the maxilla, but look, there's this little piece back here that's not part of the maxilla. That's still the roof of the mouth. So that little bone, or two, one on the right, one on the left, those are called the palatine bones. And that makes the very back side, the very posterior portion of the roof of the mouth, the palatine bones. So palatine, you don't see, let me just make sure I got everybody. Yep, palatine bone you don't see on the front, really. They're going to say that you see a little snippet of it here. I disagree. That's K. But if you come to this side, and I will talk about these views, that underside view, those are the palatine bones. So let's talk about what we're seeing here on this side. Clearly, we've got an anterior view and a lateral view. This, I think, is pretty understandable. We've got a section right down the mid-sagittal plane, except the mandible has been removed, and then we're looking at it this way. So occipital towards the back, nasal, maxilla towards the front. These two are probably the hardest for students because they look similar. So you really need to kind of take note of what you're looking at. This is a view from above with the top of the skull cut off. So we're looking down from the top into the cranial cavity. If I showed, I can't really show you on here, but it would be almost as if we were going to cut the skull like this and then look on the inside. So I can mimic it somewhat if I hide both parietal bones. We still get a little bit of frontal here and occipital here, but that's similar. So frontal bone, all of that's ethmoid. It won't highlight at once. Sphenoid, temporal, occipital. That's pretty much all you get on this view. And the last view is from underneath. Notice we're seeing the teeth, the upper teeth, but the mandible, lower jaw has been taken off. So this is a bit more complicated view. This is going to be, I can't show you fully because as soon as I hide the mandible, it leaves the teeth, but I could hide every one of those teeth. Give me a second. Okay, I have attempted to replicate your image here, and I'll show you those things real quick. Here's maxilla. That's all maxilla. Now it has individual parts, but we won't learn those till later. Here is, did I delete the palatine bones? Shoot. I accidentally deleted those palatine bones. They will sit, I don't know how I did that, here and here. And I think on your diagram they're letter K. Other than that, occipital, temporal, zygomatic, and in the middle we'll get some sphenoid and a tiny bit of vomer there. And then palatine, like I mentioned, will be here. This is temporal because, if I can twist it around, the parietal we can't really see because it's underneath. Okay, one last item, which is the associated bone nearby. And it's not a skull bone, it's not a cranial bone or a facial bone. It doesn't go with any category that we have learned so far. Not vertebrae, not ribs, not skull, certainly not a limb. Is this weird thing in the neck area, and it is called the hyoid bone. Notice its shape is kind of like a horseshoe. And if I add in other structures, let me get the whole skeleton here. It's still highlighted there in blue. You see it sits at the top of the larynx, the voice box, but it's not actually making a joint with any other bone. And it has ligaments that run to that little spiky thing by the ear. And it just provides anchor for part of the tongue, which I don't know why the tongue isn't showing up, but it should be anchoring to the tongue, and that is called the hyoid bone. You can see it here. So that's just an associated bone that's nearby, but it's not actually a skull bone at all. All right, that concludes the cranial and facial bones.